To give you a little bit of a feel for what we'll be discussing today on the webinar, first, we will do introductions for our presenters. Then we will discuss an array of resources that are available to support your grant programs, focused on different diversion concepts and reentry best practices. Next, we'll hear from BJA, who will provide an overview of the Justice and Mental Health Collaboration Program and the Connect and Protect Grant Program. We will provide information about training and technical assistance that we'll be able to support you in for all of the grantees. And towards the end of the webinar, we'll have time for questions and answers. We're also going to do a brief breakout to split out the Justice and Mental Health Collaboration Program and the Connect and Protect grantees at the end of the webinar. So to go over some housekeeping issues for you all, anytime during the webinar, if you have a question, you can ask it through the question and answer box or the chat box at the lower right-hand corner of the screen. If you have any technical issues, you can put it there, as well as questions related to the content that we're covering. We'll reply directly to the technical issues in the chat window. For the content related questions, we're going to actually hold them all towards the end, and we'll keep a running list so we make sure to address as many as we can before we sign off. If you encounter technical or audio problems, please just drop information in the chat box, and understand we know there are some technical issues that might arise that might not be able to be resolved. We are recording this and we will post it on our website by the end of next week. So I want to introduce you to our awesome panelists today. We have Aisha Delaney-Brumsey, who's the director of the Behavioral Health Division at the Council of State Governments Justice Center. Dr. Delaney-Brumsey oversees the Behavioral Health Division at the CSG Justice Center, which focus on reducing incarceration of and improving outcomes for people with behavioral health conditions. Before joining the organization, Aisha was the director of Behavioral Health Research and Programming at the New York City's Mayor's Office of Criminal Justice, where she helped advance a number of reforms, including investments in the city's crisis response services, supportive housing for people with a history of justice involvement. Prior to that, she was the director of substance use and mental health at the Vera Institute for Justice. Next, we have Maria Fryer, who is the Justice Systems and Mental Health Policy Advisor for the Bureau of Justice Assistance, which is part of the U.S. Department of Justice. Maria oversees justice and mental health and the Connect and Protect portfolios, and collaborates with the CSG Justice Center to assist states, local governments, and behavioral health organizations to better understand the relationship between criminal justice and mental health populations, to help create policy and programming that meets the needs of municipalities and the citizens they serve. Previously, she worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Fryer has worked in community corrections in Fayetteville, North Carolina, helping people to develop intermediate community-based sanctions for repeat offenders with drug addiction. She also served in the United States Army as a member of the Military Police Corps. Next, we have Ernest Stevens, who is the Deputy Division Director of Law Enforcement at the Council of State Governments Justice Center. He oversees a portfolio of work focused on improving outcomes for people with behavioral health conditions and homelessness who encounter law enforcement. Ernest supports communities in adapting, implementing, and evaluating new practices. Previously, he spent over 28 years in law enforcement, helping develop new programs and policies for the San Antonio Police Department. He also worked as a program manager of the Southwest Texas Regional Advisory Council that oversees emergency operations for 22 counties in Texas. Also joining us is Demetrius Thomas, who's a Deputy Program Director for Behavioral Health at the Council State Government's Justice Center. He supports the oversight of the Justice and Mental Health Collaboration Training and Technical Assistance to grantees. Prior to joining the CSG Justice Center, he worked at the New York City's Department of Health and Mental Hygiene, where he led several initiatives at the intersection of criminal justice and behavioral health, including establishing New York City's first diversion centers, co-response, and mobile crisis teams. We also have Allison Upton, who's a Deputy Program Director of Behavioral Health at the CSG Justice Center. She supports the oversight of training and technical assistance to grantees and the policy development and projects specializing at the intersection of criminal justice and behavioral health. Prior to joining the CSG Justice Center, Allison worked at the Center for Alternative Sentencing and Employment Services, or CASES, as the Director of Court Programs, where she oversaw court and community operations of several alternatives to incarceration and detention programs serving adults with behavioral health needs in New York County. Allison previously worked as a staff psychologist in an inpatient unit at the Manhattan Psychiatric Center and the director of outpatient programs at Brock Children's Psychiatric Center. She received her BA from University of Miami, MS and PsyD in clinical psychology from Nova Southwestern. Lastly, I'm Sarah Wurzburg. I'm a Deputy Division Director for Behavioral Health at the CSG Justice Center. I oversee our training and technical assistance for the Justice and Mental Health Collaboration Program, the Second Chance Act Behavioral Health and Housing Programs, and I lead work related to substance use, mental illness, and housing. I'm going to now pass it to my colleague, Maria, who's going to tell you a little bit more about the Department of Justice.
And I'm on mute. Thank you, Sarah. It was great to be here with everyone today. My name is Maria Fryer, and I'm a policy advisor over the Justice and Mental Health Collaboration Grant Program, otherwise known as JMHCP, in the Policy Office at the Bureau of Justice Assistance. And I come from many of the communities and programs that you represent, as well as state administration and working on statewide solutions to help improve response and cross-system collaborations. And I look forward to working with all of you to make your JMHCP program a success. So we have to open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing a grant in a very competitive year. This is a very competitive program, and your application was screened for basic minimum requirements. It was reviewed and rated and scored by panels of external peer reviewers, and after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So congratulations to everyone on your award. So a little bit about expectations and what we can expect from you and what you can expect from us. So since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations that we have of you. So we'll expect you to think about how your systems can be more responsive to people with mental health conditions and co-occurring mental health and substance use disorders in the justice system. That you will take on the planning process and all the grants with gusto and be excited to work with your TA coach. We are making a difference through this work. You will use validated screening and assessment tools and assessments for mental health conditions and substance use disorders and criminogenic risk. And you'll seek appropriate services and identify system gaps for serving people with mental health conditions. That you will seek help when help is needed and communicate regularly with your technical assistance coaches and BJA staff. Then you'll have a state policy advisor from our programs office who will help you with your budget and grants management and day-to-day management of your program. And of course, I'll help on the policy side. And your expectation of us. So you can expect that we will support and assist you as you set to reach the program goals to enhance your system and reach everything that you intend to reach in your program. We will want you to help you with your staff and to have the necessary tools to serve this critically underserved population to help your communities. Both program staff and policy staff will be responsive to your inquiries as they arise, whether they are technical or about allowable uses of funds, changes in key staff, or requesting no-cost extensions, or whether they are regarded as critical changes at the state or county level, or you foresee some potential problem impacting your program. We're here to help. So a little bit about the Bureau of Justice Assistance. And as you see, the slide says it all. We basically are here to support states and tribes and local communities. And we help to improve cross-system collaboration, to reduce recidivism, to connect people to treatment, and we provide programs and funding to do that. So we're here to help you. I'd like to go ahead and pass this over. Not yet. I got to say a few words about the Council of Governments State Justice Center. I have to for sure say we have worked together for a very long time. So they have brought to light how to serve people better in the justice system. And one of the landmark projects was something you might be familiar with called the Consensus Project. And this was back in 2002. And since that time, there was lots of movement and legislation, which became the JMHCP, or the Justice and Mental Health Collaboration Program. And the CSG Justice Center has been there since the very inception of this program. The CSG Justice Center is the technical assistance provider for JMHCP grantees. Each of you will have a TA coach, as I mentioned, and the CSG Justice Center will help you, and they will guide you, and they'll challenge you, and they will support you. Overall, considering everything that we've shared so far, we're trying to achieve better outcomes for people with mental health conditions and co-occurring mental health and substance use disorders in the criminal justice system. Specifically, we're looking to enhance law enforcement responses, reduce the prevalence of people with mental health conditions in jail, think how to best address high utilizers in multiple systems, and improve access and connection to community-based behavioral health care. This includes the important work to develop police mental health collaborations, to work towards collaborative county and regional approaches, to look at the data to decrease number of people with mental health conditions in jails, and have systems think strategically and plan for diversion for people with behavioral health needs. We are excited for you to work to use your data systems to develop evaluations, track performance, and through your performance measurement tool, or PMT. We will talk more about the PMT in the second or third orientation. I believe it's the second one. Each program has worked hard to get together an advisory group at the local level and put together a great proposal. And we want to make sure that you share your outcomes with the field, especially through the PMT and the data that's collected through that important tool. So here we are again about the Bureau of Justice Assistance. And as you can see, our mission is to provide leadership and services in grant administration. And I've talked enough about all of this. So I am going to go ahead and say a little bit now about the programs office. So in addition to the policy office, I want to talk a little bit about the programs office. Also, as you're familiar, within the Bureau of Justice Assistance is the programs office, and they manage the individual awards that each of you have received. And as such, have been assigned, each one of you has been assigned a grants manager, either Nikisha Love or Tammy Lovell. Nikisha and Tammy will be your contact within BJA and with support from Eric Dietrich, the division chief, who can answer all your questions pertaining to allowable costs and management of the award and reporting. And you'll hear from Nikisha and learn more about their work in the second orientation. We work closely together, policy office and program office, to ensure that all the JMHCP and Connect and Protect grantees remain on track with their awards. So with this brief introduction, I will turn it back over to Dr. Aisha Delaney Brumsey to talk a bit more about the CSG Justice Center, the history of JMHCP, and provide critical context about people and behavioral health needs in the criminal justice system. So you'll hear a little bit more from me a little later in the presentation. I'm going to hand it over to CSG Justice Center and Aisha.
Thank you so much, Maria. It's great to be here with all of you today. I just want to echo what everyone said about congratulations on your award. My team and I are very, very excited to work with all of the JMHCP and Connect and Protect grantees that are on this call. So thank you for being here. So for those of you who are not familiar with the Council State Government's Justice Center, we are a national nonprofit that focuses on improving justice system processes across the country. We work as a membership organization that represents state officials in all 3 branches of state government. But what that means for you is that we work very closely both with government, providers, and everyone who has an investment in improving justice and health systems across the country. Next slide, please. And so the way we work is that we really strive to bring people together to solve some of the most challenging problems that all of you all in your local jurisdictions are facing. We use research to really inform that work and drive towards and build for policy change. And we also provide expert assistance or technical assistance, which is a lot of what you're going to be hearing about today, because that's a lot of how my team will be interacting with you and your team. Next slide. So next, I'm going to give a little bit of a history of the Justice and Mental Health Collaboration Program and the Connect and Protect program as well, and a little bit of context there. So through the Justice and Mental Health Collaboration Program, which also funds Connect and Protect, as you've heard, BJA really aims to help states, local governments, and tribal organizations improve responses and outcomes for people with mental health conditions or mental health and co-occurring substance use conditions who come into contact with the criminal justice system. And they do this in such a way that supports public safety by facilitating collaboration across justice, criminal justice, juvenile justice, and mental health and substance use treatment systems, as well as other social systems, social service systems. That JMHC funding was reauthorized through 21st Century Cures Act, and including in this bill's range of initiatives are several criminal justice reform measures related to the issue of mental health. This bill was a real milestone in the efforts to address the needs of people with mental health and co-occurring mental health and substance use conditions in the criminal justice system. And we've been really proud to support that work as the technical assistance provider and work closely with BJ and all of you and your previous JMHCP and Connect and Protect colleagues. Next slide. So none of you would be in this virtual room if you were not aware what this slide says, which is that we have known for a long time and we have been working to address the real crisis of the overrepresentation of people with mental health and people with mental health and co-occurring substance use conditions in the justice system. And you all have recognized that, and that is why you applied for this work, and that's the work that you're going to be doing going forward. Next slide. This is just a little bit of background. This is some of the best data that we have on the overrepresentation of people with behavioral health conditions in jails. And what this shows is that relative to people who are not incarcerated, the rates of serious mental illnesses among people who are in jails is about 35%, compared to the 5% for people who are not incarcerated. And among people with serious mental illnesses, you can see that the vast majority of them also have co-occurring substance use conditions. And so this really highlights not only the importance of addressing this over-incarceration, but it also highlights the importance of really working to address both the needs of people with serious mental illnesses as well as the needs of people with co-occurring substance use conditions. Next slide. And this slide is data that just depicts the rates of substance use conditions in the criminal justice system. This is data from actually the Department of Justice's Bureau of Justice Statistics. And what it shows here, similar to what we saw on the slide with serious mental illnesses, is that there's significant overrepresentation of people with substance use conditions as well. Next slide. So while the data that I was giving you really focused on the overrepresentation at that point of incarceration, what we know is that many of you rightfully in this virtual room are not just focused at the point of incarceration, that you're also looking at what happens before people come into contact with correction systems, especially the Connect and Protect grantees on this call, but many of you are thinking about the ways that people come into contact, people with behavioral health conditions come into contact with law enforcement, and the ways to improve the outcomes of those interactions, and really to equip law enforcement with the tools and resources that they need to respond effectively in those situations. And this is just one data point that we think illustrates some of the challenges that so many jurisdictions face, which is that even something like training for law enforcement, which is one of the backbones of a lot of the work that we see jurisdictions doing to improve how law enforcement responds to people with behavioral health needs, even training for law enforcement is not very standardized and is not always available across jurisdictions. So we're always very excited when grantees are looking to build out that kind of training, and also to make sure that that training follows best practice guidelines. Next slide. And what we also know is that many of you are going to be addressing the real gap in the access to care for people with behavioral health conditions who come into contact with, people who with behavioral health conditions who come into contact with the criminal justice system. And what this slide is here is a 2018 national survey from SAMHSA on drug use and health that shows that about 1 in 3 adults with a serious mental health condition and a substance use disorder do not receive needed care. And we know that in many jurisdictions, that disparity is enhanced for people who have criminal justice involvement. So that just drives home for me the point that it's especially important, the work that you all are doing to ensure that there is effective access to care for people at every point in the justice system, whenever possible, from initial contact with law enforcement all the way to reentry in the community. So I hope that gives a little bit of context on some of the ways we think about the key issues that people are facing in the criminal justice system, and some of the work that we know that you all will be tackling. In the next slide, I'm going to turn it back to my team member, Sarah Wurzburg, to continue on with some of this context. Thank you, and congratulations again.
Thanks so much, Aisha. So people with behavioral health needs have a lot of complex challenges: mental health, substance use, which we talked a lot about. There's a need for reducing criminogenic risk and risk reduction programming. There's other needs that could include transportation, housing, peer support. And the fun part about all of this is, I know you know, at the state and local level, often this is multiple systems to coordinate across, multiple people to find, to get to know, to start working with, as a part of these grant programs, and really trying to think about how to address the behavioral health needs, as well as the different criminogenic and other risk factors at the same time, in order to actually reduce recidivism and future justice systems contact. So another critical piece is addressing the overrepresentation of people with behavioral health needs in the justice system. And this is some results from SAMHSA and Kaiser Foundation's studies that you will see summarized. Is that there, as Aisha mentioned, there's a significant gap in the connection to community-based treatment services across our country. We see that even those with health insurance accessing care for mental health and substance use services is challenging. This specifically calls out that 1 in 5 people who need substance use treatment don't get it from a specialty care facility. So building on the idea of the complex needs and challenges, there's just so many things that people who have mental illnesses and co-occurring substance use disorders need, from the clinical services and treatment to integrated co-occurring treatment, services and support, and crisis response and community engagement to really help them throughout all these processes. And unfortunately, throughout their country, there's a lot of challenges with this: a lack of integrated treatment, a lack of trauma-informed treatment available, some crisis systems that are underdeveloped, so they don't really have other, multiple responses that they can seek. And, the need for additional housing is a big one that we're seeing nationally right now, as just from reading the news, you probably see articles about that. So when we're thinking about this, we actually think a lot about the different diversion interventions. This is one of the publications that was actually linked in the applications that you all applied for. So we really think about opportunities where people with mental illness and co-occurring substance use disorders could potentially have other outcomes. So could be pre-booking, so law enforcement initial contact. Who are the people that, need to go to jail versus need connections to support services, or, need to be arrested versus not. In jail, there's also the opportunity to identify people with mental illness and substance use disorders. You can look at it at pretrial and the court systems as well for post-booking diversion opportunities to make sure people are really connected to the case management, the treatment, the supportive services, housing, education, vocational services as well. Next slide. So the publication really talks about leaders seeking opportunities to build gaps across the system. The criminal justice system has often many systems within it too, depending on the way your county is setting up. So making sure that there is county and statewide strategies in terms of diversion opportunities, as well as supports for people who make it further into the justice system as well. When we think about effective treatment, we really want to address both the criminogenic risk factors, or the risk for people returning and continuing to be in contact with the justice system, as well as the substance use piece, which is also a criminogenic risk factor, and mental health, which is a responsivity factor. And really to think about how to integrate and address these all together, which can be a real challenge, as often it's multiple systems addressing these. Next slide. And keeping that in mind, that's actually why we developed a web-based tool on case management that really thinks about how to take criminogenic risk needs assessments, mental health, and substance use assessments, and put them all together in ideally one plan for one person. And within this tool, we have different examples of sites who are doing it and different people who can lead it: a treatment provider, community supervision, correction agencies. We're going to be adding a housing provider as one of the examples as well in 2023. And I'm going to turn it over to my colleague, Ernie.
Thank you, Sarah. Thank you very much. Again, congratulations to all the grantees. As you can see here, we're talking about the framework here of over 18,000 plus law enforcement agencies. The Police Mental Health Collaboration, or as you will come to call it, the PMHC framework, is a resource intended to assist local leaders, including elected officials, law enforcement and behavioral health executives, and their senior personnel who want to begin or improve the existing outcomes of their police mental health collaborations. Next slide. The PMHC framework supports leadership to address key areas of focus by considering 6 questions. Number 1, is leadership committed? You really need to have a champion in this area who will champion the idea of your grant here. Do we have clear policies and procedures to respond to these people? This is going to be the framework of your, as you put your program together, is having these policies and guidelines in place. Do we provide staff with ongoing quality mental health and stabilization training? Right? Do you have the mental health services that supports the people in your community? And if so, are you able to connect them and link them in an expedient manner? How do we collect the data? And then how do we measure our progress? How do we show what success is? And we're going to help you develop that measurement. And then number 6, do we formalize a process for reviewing and improving the performance that we regularly review and implement? And this is important because the only way that you're going to continue to strive and improve is if you're measuring that performance and doing that quality assurance. Next slide. As you can see, I want to talk to you for just a moment here about our learning sites. Since 2010, the law enforcement mental health learning sites have supported jurisdictions across the nation and exploring strategies to improve law enforcement responses to people who have mental health needs. The law enforcement learning sites can be utilized to learn the best practices. These approaches that have been based on the needs of your community. Their learning sites have been strategically chosen by size, population, and by resources. Next slide. As you can see here on the map, we have 14 learning sites that we have used as best practice models that you can look at. If you have not visited some of these sites and you're interested in doing a visit, we have linked services linked to the very bottom of the slides that you'll be able to have a resource to click on if you're interested in doing a visit. But you can see here that we have selected 14 sites, which are located across the country in both urban, suburban, and rural jurisdiction. These learning sites represent a diverse cross-section of perspectives and program examples, and they're dedicated to helping other jurisdictions improve their responses to people who have mental health conditions or co-occurring mental health and substance use disorders. So you don't have to reinvent the wheel. These are some of the best practices that we have available at your disposal. Next slide. At a national level, we are excited to see a lot of focus on pre-booking diversion strategies through another resource, which is Police Mental Health Collaboration, or PMHC framework. This framework outlines core components of a comprehensive and robust PMHC that produces improvements in both community-wide outcomes. Just like what I referenced earlier, this really focuses on moving all-scale training to agency-wide efforts. Maria, I'm going to turn it over to you now to give an overview of the JMHC grant program.
Perfect. Thanks, Ernie. All right. So the goal of the JMHCP grant program is to develop collaboration across the criminal justice and behavioral health systems, from law enforcement, pretrial, courts, jails, and community supervision, to learn how to have successful partnerships that increase efficiencies and improve public safety outcomes for people with mental health conditions or co-occurring mental health and substance use disorders in the justice system. And I would add to that, not only public safety, but public health as well. Next slide. So there have been over 650 awards from across the nation representing 49 states and 2 US territories, American Samoa and Guam. We are proud to have worked around the country to support local programs. And we only have, looks like, 1 state there we need to get to and make extra effort on. Next slide. Nearly $218 million has been awarded through the JMHCP grant program to improve public safety and public health outcomes and responses to people with mental health conditions and co-occurring mental health and substance use disorders in the justice system. And we are excited to have an increase in funding for this year. And it has been steadily growing over the years. So that's a good thing. That means more programming and more people on the ground doing this work. Next slide. This year, there are a total of 60 new grantees, 32 awardees for Connect and Protect, and 28 for Justice and Mental Health Collaboration. And we have people working throughout the justice system and law enforcement agencies, pretrial courts, jails, probation and parole, and all in partnership with their community-based behavioral health providers. And that's the beauty of this program, is that it is throughout the entire criminal justice continuum and that it requires partnership, which is so critically important to success. So I will go over a bit about each grant track, but stay tuned for even more information during the grant track specific orientation webinars in March. Next slide. All awardees will work under a 2-phase process. The first is planning and the second is implementation. The planning phase is up to 12 months. And during this phase, you'll work with your TA coach to complete your respective purpose areas planning and implementation guide, which will be discussed a little bit later. Next slide. So up to 100,000 can be used in the planning phase. And then once BJA and your TA coach has approved your P&I guide, then the implementation phase begins. And the performance period for all grantees is 36 months. Next slide. Eligible program participants include preliminary qualified offenders as defined in US code. So I'm going to read through a little bit about this code, just so we can all sort of hear what it says around violent offenses and things like that. So as it relates to violent offenses, those who have oversight over the program do have some authority when determining whether a person who has a violent offense can participate in a respective program. And there are specific parts of the legislation that talk about this. So it provides that in the legislation, it provides that a person is a preliminarily qualified offender if the offender has unanimously been approved for participation in the program by community members, such as the prosecuting attorney, the defense attorney, probation or corrections official, and perhaps a judge and the relevant mental health authority as well, or mental health agency, provided that those who can make approvals as enumerated in this part of the slide, if they have determined that the person does not pose any risk of violence to any other person in the program or the public, if selected to participate. So they have to make that determination locally and with the information that they have. So in making that determination, the statute requires that the following things be considered. So in determining whether the designate is a defendant as a preliminarily qualified offender, the relevant prosecuting attorney, defense attorney, and as I mentioned, all the people involved, so they have to think through things like whether the participation of the defendant in the program would pose a substantial risk of violence in the community. They have to think about the criminal history of the defendant and the nature and severity of the offense for which the defendant may be charged. They have to think about views of any relevant victims that might be involved. And then they have to think about the extent to which the defendant would benefit from the actual deliverables of the program and how it might help that person to not come in contact with the justice system again. And then the extent to which the community would realize cost savings, perhaps, or because of the defendant's participation in the program, how that might benefit the community. And then whether the defendant satisfies eligibility criteria for the program participation, unanimously established by the relevant prosecuting attorney, defense attorney, probation, corrections official, judge, mental health. So I'm listing all these stakeholders because they're all part of this advisory group, right, that manage the program at the local level. And they all have to be in agreement depending on what the charge is with that long list of things that I just read. So those are all the considerations. And there's got to be consensus amongst these stakeholders that it's okay for this person to participate. So after I saying all that, there are some things that a person, if they are charged with, they cannot participate in a JMHCP funded program. So if a person has been charged or convicted of any sex offense or any offense related to the sexual exploitation of a child or murder or assault with intent to commit murder, so those types of charges, they cannot participate in the program. And that's per the JMHCP authorizing legislation. So next slide, we'll talk about connect and protect. Okay, so the next two slides outline the various program objectives for the connect and protect grantees. So that includes design and adopt a best practices, tongue-tied, in crisis response for law enforcement officers during encounters with people who have mental health disorders. Move my slides over a little bit. And also plan and deliver a law enforcement agency response program in coordination with a mental health agency advocacy services to improve or enhance the response. So always in partnership, right? That's the recurring theme of JMHCP, always with behavioral health partnership. And then to pay salaries as well as other expenses such as training, like overtime and coordination activities, the costs involved with designing and implementing a police mental health collaboration program. And do we have a next slide? There we go. I thought we did. Also to engage citizens through officer outreach and education to improve public safety, to build positive community relations and trust through public communication strategies, to enhance officer knowledge and skills in responding to community members with mental health disorders or co-occurring mental health and substance use disorders, and increase public safety agency capacity to develop and sustain the program by collecting data to inform practices, create stakeholder groups, develop policy, and encourage ongoing professional development. Okay. So the justice and mental health, next is we have the objectives. So the next two slides, again, just reading these off for those that might be listening. Enhance, expand, and operate mental health drop-off crisis stabilization treatment centers that provide 24/7 year-round support for law enforcement, criminal justice agencies, and people who come in contact with the justice system. And these centers can provide, but not limited to, the following services: screening and assessment, crisis care, residential treatment, assisted outpatient mental health treatment, primary care services, telehealth, competency restoration, community transition, and reentry support, such as connections to housing. Next slide. Okay, so JMHCP continued increased community workforce and capacities for certified mental health peer support specialists and increase the availability of wraparound services that support people with mental health disorders and mental health substance use disorders, and also to build or expand existing mental health collaboration programs across people and places in any part of the criminal justice system, such as jails, courts, and prosecutors, as well as community supervision and or capacity building for criminal justice professionals to target individuals with mental health and substance use disorders at risk for recidivism. And that's a long way of saying that this program can cover a lot of services, a wide array of services throughout the entire criminal justice system, from first contact all the way through each intercept of the justice system, all the way through to reentry, and also in the community with wraparound services and other types of support services. Okay, next slide. I think I'm moving it on to the next person, and I'm sorry, but I have lost my place. Who is it going to next?
I think I'm taking over, Maria. we got a full house here of everyone on deck. Thank you so much. So we're actually going to open it up if there's question and answers about any of the content we covered or about your grant generally. I know it's a lot of information thus far. I do also want to let you know we will be doing smaller breakouts for the JMHCP versus Connect and Protect grantees after the questions and answers. So if you have a question right now that we can support, please feel free to put it in the chat box and we will get to answer that, or through the Q&A. I will give it a little bit longer in case anyone has questions. Okay, thank you. So the first question is, when will recipients identify and be able to begin working with their technical assistance coach? So that's a great question, and I think I can answer that one. So we have this webinar, and then we also have this part 2 webinar next week, which will cover some of the grants management overview. You'll be hearing from different colleagues from BJA about some of the budget pieces, the data you have to collect for your grant, and things like that. And then someone from the Council of State Governments Justice Center Training and Technical Assistance team is going to reach out to you in December to schedule a call for January. Since you'll have these 2 December webinars, we'll look forward to connecting with you at that point. And in the meantime, if you have questions, we will share our contact information at the end. And then I think on the congratulations emails, you were provided a couple of different email addresses for questions in the meantime. Okay, our next question is, how does an agency find out if their travel funds included in the grant to visit an existing program for best practices? That's a good question. Maria, do you want to help answer that one?
Sure. So I think you're referring to the 14 law enforcement mental health learning sites, perhaps, or another site visit. But so you would design your grant budget to include travel to the sites. And if there is, we do have some funding to help support that. But currently, if you're still getting your budget approved, because the first couple of months is all about, getting your budget approved. And once your budget's approved, you can actually begin working on your program, your planning, and all of that. But if it's something that you want to do, you can put that in your plan and begin working with Ernie and your TA coach and others at CSG Justice Center to start identifying which site you would like to visit and what types of goals and objectives, things you want to learn while you're there to help improve or enhance your program. So is there anybody else that wants to add to that?
I'll just say this: if you're really unsure of really what your program is going to look like and you're looking for a best practice model, I would really take advantage of going to see one of these learning sites, because that's going to take a lot of the headache out of the game of where do we even start? Like, who do we bring to the table? And we're going to help you with all that, right? It's like DOJ gave you the money to buy the bus, but it came from IKEA and there's 1,000 pieces, right? So we got to help you build it. And that's what we're going to do. So think about building that into your budget, because I would love to get you to a learning site, and I would love to meet you at one of the learning sites and walk you through that process as well. So for those on the call, if you're not certain, look at the different learning sites on the website, look at the ones that fit your size of your community, of your department, and then let's go out there and let's look how other people have done it. And that way it kind of fast track you through your planning stage.
That's great, Ernie. And I would just add that that's what the planning part is all about. It's really a part about sort of laying the groundwork and creating a map for yourself. And it's a dynamic type document. It can change along the way. And it's amazing how a lot of times what you begin with, you have one vision when you begin, and then depending on who you bring on board, how things have changed maybe in the environment, that plan can change as well. And so the flexibility is built in that regard.
Absolutely. And the planning phase is so important, because you'll find out from talking to your stakeholders that maybe it doesn't exactly work for your community too. And the TA coaches and us as your TA provider, we can definitely help you identify best practice sites that might be a fit for you based upon the different models you're interested in implementing. One person asked, will you see a list of awardees? Yes. So after we finish this part of the Q&A and we go into the breakouts, we'll have a list of all the awardees. It's also on the Department of Justice website, so we can find a link for that for you as well. Next question is there specific training or curriculum development required for the program? And I think I can answer that one. So there isn't. So the interesting thing about the Justice and Mental Health Collaboration Program and Connect and Protect is that there are different interventions that sites can select to use to address mental illness and co-occurring disorders in the justice systems. What we will talk about in the breakout more, and we just started talking about the planning process, we do have a planning and implementation guide that helps you really think about, is the intervention that you propose the one that you want to continue with? Do you need to make modifications based upon, it being 8-9 months since you applied for those? So there is some flexibility there, but those are all part of the process here. So what's helpful to you if you're unsure is going back and looking at what you proposed and really reading through it, and then thinking through, is that, the model that you're looking for, does that make sense? And then your TA provider will actually work through the process with you. Okay, next question. Are there webinars scheduled specifically around learning to use the SIM, or links to resources that we can check out on implementation of that. So SIM is referring to this sequential intercept model, which really looks at different points of the justice system. And so there are different, we can definitely provide resources on that and think about how you could use if you have a SIM mapping process as a part of your grant, or if you just want to look at how to connect different areas of your system. If you're seeing gaps, like your law enforcement isn't connecting with community supervision, that's something that we can share resource on and support as well. Okay, another person had actually a budget clearance question. This is a popular one. I will also point to you for next week's webinar. You will actually have the BJ programs office on, who are your go-to people for that. It says, will our 12 months of planning begin once this is finalized, or are we able to invoice for planning that we are already undertaking now that they know they have the award? Maria, would love for you to tackle this one.
Okay, so I hope I've heard it all correctly. So first, to just the timeline on the budget approval, it does take a little while, and it depends on, if there are a lot of withholdings, if you've satisfied everything to about like 80%, 90%, budget. So the programs office is going to look at your budget, then it's going to go to OCFO, and they're going to approve it, come back with any questions, and then your assigned program manager over in the programs office, either Nikisha Love or Tammy Lovell, they're going to, communicate with you on what you might need to adjust, which part of your budget, and that sort of thing. So I say all that because sometimes it's a lot of back and forth. It can take a couple of months, but it's gotten faster, and they are really, kind of streamlining this process. And it can take a little while. As far as the invoices, and we're going to get more into this in the budget management part of the webinar, the next one, the planning phase, if we go back to the slide, you are allowed to spend up to $100,000 in the planning phase. And then you use that $100,000 to complete the planning phase up to 12 months. And then you will, after that, submit your planning and implementation guide with your TA coach to me. And then I review it. And then I notify everybody. I CC everybody that it's approved. And then the programs office goes ahead and releases the rest of the grant. So you have in that first, 12 months, you have that $100,000 to get, to springboard the project, gather your stakeholders, engage in planning activities to get everybody on the same page as far as what the plan is going to be. And then sometimes you need to do that first before you can adjust the budget. So it just depends on, if you're going to go exactly with the plan you wrote, your narrative, or are you going to make some minor adjustments or changes? And then how is that going to be reflected in the budget? So it just depends, grant by grant.
Thanks so much, Maria. And usually the planning phase does start after the budget approval. So I think people feel pressure, like the top clock is ticking and you don't have budget approval, that 12 months would start upon budget approval. So certainly if that's a stressor of yours, don't worry about that. Someone asked for a link to the learning site information. I will put that in the chat for you. Another question is, are there current resources for planning process, such as past plans or templates? Yes, absolutely. So there's actually a structured planning and implementation guide that will work through with you. It's different for the JMHCP and Connect and Protect grants. So there will be some differences depending on if you're focused on law enforcement or other areas of the justice system. But we will provide a template for you to work through, and we'll work with you on all of those sections as well. So there are examples and templates on our website, but we will work with you on the specific guide too. Another budget question, these are always very popular. Is there a timeline for DOJ OCFO to complete their budget review?
Okay, so I guess I'll tackle that. It could be anywhere from, 3 weeks to 2 months. It really depends on how much back and forth there is, how big a changes you make to the budget from the original, what was submitted. If your match is straight, I mean, that can slow things down. and actually, keep that question written down and in front of you, because when we come to the next webinar, I believe there's a list of like the top, I don't know, we have on there like the top 10 reasons, budget, what slows down a budget approval and things like that. So it's good to ask the question, but we get that question a lot. So we actually created a slide. I know we have some information on that, but it really depends.
Thanks so much. And definitely bring all of your budget questions to the webinar next week. They are the budget gurus too. And then I think one person asked for clarification on if they heard correctly that $100,000 can be spent to facilitate travel to learning site locations. No, so the $100,000 is for the planning process over a 12-month period. You need to look at your budgets to see if you did travel to a learning site or another location. If you're a non-law enforcement site, we can connect you with the Stepping Up Innovator County, other jurisdictions as well. So that's the budget for the planning phase of the grant, which you may have included travel. And if not, we can have discussions about that, because as we said, visiting sites can be really helpful as well. So that is it for what I'm seeing for our questions now. And it's actually great timing, because we do want to split you up into different breakouts. So the JMHCP grantees and the Connect and Protect grantees, we're going to split up right now so we can give you a little more specific information on your grant programs. To make this as easy as possible, we have a list of all the Connect and Protect grantees. You can click on the link that my colleague Demetrius shared. For the Connect and Protect grantees, you'll go to a breakout where Ernest, who you have already met, and our other colleague Allison will join you and talk about that grant program. And then if you're a Justice and Mental Health Collaboration Program, Demetrius and I are going to stay here with you, and we're going to talk through some of the specifics for JMHCP. And if you're still unsure, even after looking at this list, if you need to chat us, that's fine as well. But I will give you a couple of minutes. I'll give you about a minute to try to figure it out, because I know it can be confusing, and you may not have been the one who applied for your award either. So if you see your name on the list on the left, you click on the link in the chat and you go to the breakout room with Ernie and Allison.
Sarah. Thank you, Sarah. And that's everyone's, and it looks like about the right amount of people for the JMHCP. So as everyone has been saying earlier, I do want to echo again, congratulations on being a recipient of your the fiscal year 22 Justice and Mental Health Collaboration Program, JMHCP. This is, or should be, your JMHCP TTA cohort. Next slide, please. Next slide. And so what we typically want to do, and we wish we had more time, but throughout your 3-year grant process, you all will have a lot more time to get to know each other well. But for right now, we just wanted to take a quick moment and ask that, so we can know who's in the room currently, and ask that as I say your grantee name, if you can just drop, if you are a member of that grantee, if you can just drop in the chat your name, say hello to us, your title and your relation to the grant, that will be great. Again, wish we had a bit more time for us to do a bit more introductions, but again, over the next 3 years, we will definitely get to know each other well. So the first is, we have the County of Anderson. Would you all who are on the team like to drop your chat in? And we see I have a question, Pima County or Tuscan Court. As the County of Anderson the folks are dropping their introductions in. Are you a Connect and Protect grantee? Or if not, you could be on the next page. Do we have the County of Anderson folks here? Just drop your name, your title into the chat. How about the City of Brighton? Their team here. Feel free to drop your name, title into the chat. Central Texas MHMR Center. All right, Sansa Movement. Welcome, Central Texas folks. Georgia Department of Community Supervision. All right, it's coming through. Thank you all. How about now the County of Hamilton? Your folks on the call, introduce yourselves in the chat. All right, the County of Isle of Wight, is that how you pronounce it? Sorry if I'm butchering your jurisdiction. Next up, we have the County of Johnson. Next slide, please, and Andrea. How about the Judiciary Courts of the state of Iowa? Your folks here. Keweenaw Bay Indian Community. And I know I'm going to butcher this. The County of Kittitas. How about folks from the city of Lawrenceville? How about the County of Huron? The city of Mission? All right. How about folks from the County of Montgomery? Next slide. The County of Pima. All right, so you all dropping your introductions in. How about the city of Portland? How about the team from the County of Richland? Richmond Behavioral Health Authority? The County of Rogers? How about the team from the San Francisco Bay Area Rapid Transit District? How about the team from Spindletop MHMR Services? How about the team from Superior Court of Guam? All the way from Guam representing, thank you so much. How about the Texas Department of Criminal Justice? The city of Tucson? How about folks from the County of Union? How about the team from the University of Alabama? How about the city of Utica team? How about and rounding us out, I think this is our last JMHCP grantee for fiscal year 22. How about the West Texas Center for Mental Health and Mental Retardation? All right, so this is your fiscal 22 JMHCP cohort. So again, congratulations everyone, thanks for joining. We are now moving into the portion of the presentation where we're going to talk a bit about CSG's Justice Center and how we provide and are the technical and training and technical assistance TTA to support you with your grantees. So we're first going to talk about some of those TTA opportunities. Next slide, please. So as mentioned earlier, all of you as being a grantee will receive your own individual TA provider who will be supporting you and walking through you each step of the way for all 3 years of your grant. We're going to talk a bit later about and more in depth about the communities of practice, the TA plans, and P&I guides. However, now I want to talk to you about other opportunities that you will have with the TA provider that you are given and your TTA that you will be receiving from us at the Justice Center. Every month, you will have a monthly call with your TA provider. That call will have an agenda, and throughout that agenda, you will be discussing things about the deliverables for your program, how to achieve your deliverables, your planning process, the implementation process for all of your deliverables, as well as other administrative, budgetary things, and other programmatic areas. You will also, as part of receiving some of your TTA, be able, we will be, if necessary, providing site visits. So we will become visiting you at your location, and just to see how your sites are developing, your program is developing. You also will have the opportunity for peer learning. Peer-to-peer learning is as we said before, is the opportunity to meet a jurisdiction, maybe at a learning site or another potentially old or new grantee, JMHCP Connect and Protect grantee, who is doing similar work to yours, who we think you could potentially benefit from hearing from their program and how their program has developed and has been planned and being implemented. You will also have the opportunity to receive a litany of resources that we have at the Justice Center at our disposal. Also, again, all aimed at helping you achieve the deliverables and goals within your program, within your 3-year grant cycle. Not listed here, but you will also have is access to experts. So we have TA consultations with national experts. Those national experts have a range of expertise on a range of topics that are really and can be really critical to the services in your programs and your deliverable. In the past, they have ranged from data and evaluation. It has ranged from racial equity. It has ranged from and included how to engage and work with law enforcement. So there's a litany of subawardees and national experts that we work with that you will have at your disposal if you think that a TA consultation will be beneficial for your program. We also do a number of distance-based trainings, which includes webinars and convenings. These trainings have multiple topics and cover a series of things and are really designed and chosen by what we see developing in the field as topics that are of interest to you all, and what we see coming through in terms of what you all are saying are of interest to you and are needed for your program. So we really do try to design our webinars and our convening to be real time and designed around real issues that you all see as being relevant in the field and that is coming up within your programs. Next slide, please. As previously mentioned throughout, the first thing that you all will need to do, as mentioned throughout your program, the first thing that you all will need to do within the 12 months is complete the P&I guide. The P&I guide is specifically designed for the Justice Mental Health Collaboration Program grantees. So it's specifically designed for you all to help you think through and facilitate your programs and meet its deliverables. The general structure of the P&I guides, it's 7 sections. The 7 sections are listed here. Each of those sections specifically have exercises designed to help you really drill down on each of these section areas. And again, to help you think through and advance your program and its needs. Next slide. As we mentioned, section 7 of the P&I guide is a section designed around your TA plans. The TA plans is really focused on moving your grantee, moving the work that you are doing forward, and to make sure that you meet your grant milestones within the 3-year grant cycle. You will be working individually with your TA provider to develop your training and technical plans. You will be working, and this will give you the opportunity to work with your TA provider to develop goals and identify needs to meet those goals. There also will be a layout of the goals, and the purpose of your TA plan is really to be real time. As you're working through your deliverables, it's an opportunity for you to identify the deliverable, the goal, the steps, and the time frame around those steps to achieve your overall deliverable within a reasonable time frame from your grant cycle. Next slide. I'm now going to pass it over to my colleague, Sarah, who's going to drill deeper in about some of the other deliverables and services that we provide for your TTA. Sarah?
Thanks so much, Demetrius. Yes, so we do have communities of practice available to grantees, and this is really smaller cohort learning. So simple, similarly to how this is a breakout group with a little bit less people, you can answer more questions, get more time to discuss and touch base. That's really focus of the communities of practice. So there's going to be one with data collection and evaluation that will be supported by Dr. Faye Taxman, who is a researcher and University of Professor at George Mason University's Center for Advancing Correctional Excellence. She's going to help think through some of these hard data and evaluation issues with different sites. We're going to have a focus on sustainability planning and really thinking about just how to have the right metrics to make the case for future funding. And it's actually kind of good timing to try to do this type of session at the beginning of your award, so you're getting things that the county or state is interested in, so you can actually make a pitch for additional funding beyond the federal funding after the program ends. And then the third community of practice is on reducing housing barriers to support jail diversion. So really one of the key issues we hear about nationally is housing, and how do you do some of those connections to care? What kind of outreach do you have to do to get people into housing and reduce some of those barriers that happen in different communities? So one way to stay in touch with the CSG Justice Center is actually to sign up for our newsletter. So encourage you to subscribe if you're interested in content. I think a lot of the stuff we've talked about is put out through here. There's also going to be webinars. Your TA coach will share some of that information, but there's a lot of helpful content at the intersection of behavioral health and justice that will be available to you all. So we have question and answers part 2. There's less people on the line this time around, but this really was focused on giving you an overview of some of our training and technical assistance work and how we work with you. So we are happy to take some questions. If you want to put them in the chat, if you have any, we're more than happy to answer them. And so I think there was a lot of questions in the last part about the planning process. And so what Demetrius went over about the planning and implementation guide, that was really what the planning process will look like for us to support you over the next 12 months as you work to get some of that information in. Demetrius is also sharing some links of some of the resources that we discussed. Does anyone have any other questions that we can answer?
Sir, I may have zoned out for a minute, but did you just answer the question about can folks get a link to the P&I guide?
I answered that previously, but yes, we will be sharing that with you. And there are some examples of past guides on the CSG Justice Center website as well. So when your TA coach reaches out, they'll hopefully have some more information for you about that. So I'm gonna go through some of the additional content, but you can still please feel free to ask questions in the chat if you want to. We're here to answer them. We want to make sure all of them are answered. Just give you a sense for some other information and resources that are coming up. So the big thing, and I know we mentioned this several times in the webinar, is that next Wednesday from 12:30 to 2 Eastern is another orientation webinar. That's part 2 of this. It's going to go over program management with the Department of Justice, Bureau of Justice Assistance Programs Office. And that's really important. These budget questions that you have, how to get your budget clearance passed, what are some of the typical tips and tricks that happen with that, or things that trip people up. We're also going to go over performance measurement. So there is some data collection required when you receive one of these awards. So making that all clear on this second part of the webinar next week is going to be super helpful. If you haven't registered already, please feel free to register. Demetrius dropped a link for the registration in the chat. And if you have a financial point of contact, this might actually be a good thing for them to join, because some of the financial pieces we'll be going over in addition to the performance measurement piece. So both the grant and the grant administrative, as well as the financial point of contact, this session could be helpful for. BJA also wanted us to make sure you are aware that so every year there are new solicitations as long as Congress allocates new funding. So there will be next year's award. I know it's hard to think about. You just got this year's award, but there is an additional funding opportunity. So if there's other people in your community who are interested in this type of funding, or surrounding counties within your state, feel free to share them with this link. So this will be to discuss that next round of solicitation. Next slide. And then the same thing for Connect and Protect. So people who are looking for the law enforcement, behavioral health specific funding, the fiscal year 23 information on the solicitation will also be in January. And then upcoming, so some of you asked when your TA coach will be contacting you for the first call. So in December, we've got these 2 orientation webinars. So the expectation is you'd meet with your TA coach in January, and they will reach out to you to schedule it. So they'll reach out to you as the main point of contact, or if you've shared with us other points of contact for the grant, they'll reach out to everyone and work to schedule that with you. So our expectation is that you would hear from them at some time in December, and we'll work to get that scheduled in January. In the meantime, if you have any questions, we have additional contact information to share. Next slide. So different resources we discussed, Demetrius also shared these in the chat. We've got the collaborative comprehensive case plan model to address criminogenic risk and behavioral health needs. We have diversion strategies, which really looks across all the intercepts within the justice system to think about opportunities for people with behavioral health needs to have different outcomes. Next slide. I think this is a repeat. Maybe we're going in the wrong direction. There we go. So Maria Fryer, who you heard from earlier, will be your BJA policy office point of contact. Her email is here. If you have any policy related questions, she will be your go-to person for the life of your grant program. Demetrius, who you just heard from, and myself are people to reach out to on the training and technical assistance side. If you have any questions, reach out to us, and you'll also be hearing from your TA coach sometime this month as well. And then we have a question. Do you have resources for crisis response centers? Yes, we do. They are not listed on here, but we do have resources for crisis response centers for sure. And we're happy to share that. I believe that we have some examples on our website of how to build a coordinated crisis response system and crisis centers. There's one publication there. We also have a crisis response web page that I can share with you. And we have some examples from different past JMHCP grantees who have actually built crisis response or diversion or drop-off centers. So we have some examples on the website too that I think can be helpful to you. And I will share one of these is 4 tips to successfully open a crisis stabilization unit. So that one might be really helpful to you. Demetrius is flagging another question. Thank you. I didn't see this one. Just Grant shows the program report is due by the end of January. With our budget not being completely approved, will the submission still be due? So I believe that the answer, definitely save this and answer this next week. I believe from our perspective, the answer is that I think this gets confusing to people because you're also like, well, I haven't served anyone, so what do I put on it? You can indicate that in your response that you haven't served anyone, you know, the budget hasn't been approved and all of that. But we can also make sure to ask the programs office how they would like that to be handled, because it does sound like you already have access to Just Grants. Okay, any other final questions that anyone has? Well, we just again want to congratulate you on your new award for Justice and Mental Health Collaboration Program. We're really looking forward to working with you and for you getting to know the other amazing people and leaders in their communities on this call throughout the next few years. So thank you so much for joining. Thank you, Demetrius, for your help and support on this. And we hope everyone has a great afternoon. Wishing you all well.